My name is Isaac Fowler, and this is my medication administration video. So the first thing we're going to do before we enter our room, our medication room, is we're going to check our physician's orders. We see for Mr. Jonah Doe what he's prescribed. Uh, he has no allergies, and that's important to know before we go into the room. So when we get to our medicine cabinet, first thing we're going to check all of our medicine that we have here against our MAR. First thing that we have is insulin NPH, 10 units. I have more than 10 units here. The expiration date is in 2029. This is to be given sub-Q at this time. And also to be given sub-Q with the NPH is we see has regular insulin, 5 units sub-Q. This is also in 2028 is when the expiration date is on the regular. And it is given at this time. Also, he has ordered Rocephin, 500 milligrams, and this is our Rocephin. It goes out in December of 2020, so it is still good. And we are to be given 500 and we have on hand 500 milligrams per milliliter. We have more than 1 milliliter here. All we need is 1 milliliter to fill the 500 milligrams, and is to be given IM at this time. And last, we have our tuberculin test. The expiration date is not out. We're to be given 0.1 milliliter. We have more than 0.1 here, and it's to be given intradermally. And next, we will go to our medication setup room. All right, we're gonna start on preparing our medication. First thing we're going to do is we're always going to perform a hand hygiene before we start preparing for a med. And then the next thing we're going to want to do is we're going to start with our insulin. Make sure that we've gathered all of our supplies first. We're going to make sure that we have to have our alcohol preps. We have our medicine here that we're going to be giving. I'll set aside for the moment. And we have our syringes, as well as an extra needle that we're going to be needing later for when we give our IM. Our IM is going to be, it always has to have a second needle because we have to use a different needle to inject with than we do to draw up with. The next thing that we're going to be needing is, this will also be later, our Band-Aids will also be later for when we have to do our, we're going to put it on for our after our injections. Next thing we're going to be doing is we're going to start with our insulin. We have our NPH and our regular, and just to make sure it's cloudy without, I don't want to vigorously shake it, I'm just going to roll it. And just kind of make sure that's cloudy throughout our NPH. And we can see that it is cloudy. And the next, for both our NPH and our R, we are going to clean the tops of our bottles because they are reusable. And even if they're new, we want to make sure that we clean it because we just don't want any chance of contamination. So I'm going to be cleaning my R while I let my NPH dry, because I'm going to be starting first with my NPH. And so I'm cleaning my R, letting that dry while I get on to, I'm going to use my orange syringe. And you always want to make sure to inject air as much as you're going to be taking out. So for our NPH, we are prescribed 10 units. And we've already checked our rights once through our MAR. When we took out our medication, we're going to be checking them again. We're going to make sure this is Mr. Jonah Doe. He does have insulin, NPH, 10 units sub-Q at this time. This is not expired. And we are going to pull up our 10 units. See, I have our 10 units. And inject to our NPH. And same thing for our R. We are going to look for, this is Mr. Jonah Doe. He is prescribed regular insulin, 5 units sub-Q at this time. It is also not expired. We're going to inject into our R and make sure when we turn this over that it is carefully. We do not want to bend our needle. And we're going to slowly pull up 5 milliliters, making sure we have no air bubbles. And then next, we are going to give our NPH and our R at the same time in the same shot, so it's only 1 shot for the patient. We've already inserted our air. We are going to stick into our NPH and invert it, being careful to do so. And we are going to pull back very slowly because we don't know if we can't push in because we don't know how much R and how much NPH is in it. So we're going to be very careful and pulling it back is to get no air bubbles. As you can see, since 5 and 10 is both 15, so we're going to have 15 liters is what we, or 15 units is what we pulled back to. And we're going to scoop our cap, and we're going to place it in a bag that I already have labeled. It is for, we're going to make sure we have it is for Jonah Doe. It is NPH 10 units, R 5 units to be given sub-Q. I'm going to have that labeled and set that aside. That is our first medication. Alright, so the next thing we do, we're going to move our insulin out of the way. And the next that we're going to pull up is going to pull up our Rosefrin. See, on our MAR we can see that we have Rosefrin 500 milligrams, and this is the only medication that we're going to be giving today that has any dose cal involved in it. We can see that we have 500 milligrams per milliliter on hand. So to get his 500 milligrams that he is prescribed, he needs 1 milliliter. So we know that we're going to be drawing up 1 milliliter, or 1 cc. We're going to wipe our lid. And we're going to be using our standard syringe. And we're going to inject 1 cc of air. 1 cc of air. And then being careful to make sure that our needle is below the water so it is not to get any air bubbles. We are going to pull up our 1 cc. And any air bubbles that we get, we're going to gently flick to the top and pull back some more that we need so we can flick our air bubbles to the top. And then push back in to the one that we need. You see that is our 1 milliliter. We're going to scoop our cap. And while we're doing this on what we're doing on our Rosefrin, we always want to make sure that he was given 500. He is prescribed 500 milligrams for Mr. Jonah Doe IM. So that is our rights for our Rocephin. It is not expired. And that's the second check on the Rocephin and our insulins. And we're going to place it in our bag that is labeled for Mr. Jonah Doe. That it is Rocephin, 500 milligrams and 1 milliliter. And is to be given intramuscular. And it is also at this time that this correct time for the Rocephin to be given to Mr. Jonah Doe. So we have our tuberculin test last. We're going to be using our red cap syringe. Take our alcohol. Always disposing of this in the disposal bag that you have nearby. And wipe off the cap. And we're going to be taking this one. We're going to pull back 0.1. Have 0.1. We're going to be inserting that into our tuberculin. Being careful that the needle is below the water. We are going to pull back our 0.1 of tuberculin. So my needle is straight and I do not have any air bubbles. We're going to take our cap. We're going to scoop our cap. And always, before we draw up, we always check our rights. The TB skin test, it is for Mr. Jonah Doe. 0.1 milliliters to be given intradermally. And it's to be given at this time. And then we label in our bag that it is for Mr. Jonah Doe and it is a tuberculin test, so 0.1 milliliters to be given intradermally. Now we still have our supplies. We're going to need more alcohol preps for when we get in the room. We still have our needle, our extra needle to be given for our IM. We have our Band-Aids. And now we are ready to move to our room. Alright, the first thing we're going to do before we enter the room, as we're entering the room, is we're going to do our hand hygiene. Next thing we're going to do, going to introduce ourselves. My name is Isaac Fowler. I am a Bevel State nursing student, and I'm going to be assisting your RN today. What I'm going to be doing is I'm going to be giving your morning medications. And go ahead and put in all of your, you've already gathered all of your equipment, your alcohol prep, your Band-Aids, your medicine. Let's see, I have my medicine. And your Sharps disposal box. And then you're going to identify the patient, 2 patient identifiers with the name and the date of birth. You can also check their hospital number against your MAR. And then the next thing you're going to do is explain I am giving your morning medications, and we're going to be doing an intradermal, an IM, and a sub-Q injection. So the first thing we're going to do is we're going to grab our gloves. We're going to give our TB test or tuberculin test first. And on the injection sites, when you're later on in the video, I'm going to be showing my injection sites in a real person and how I would find my landmarks and how I would show my injection. Alright, so the first thing I want to do is we're going to take our alcohol swab. And we're going to wipe off the place that we are about to administer our shot. Set our alcohol swab aside, take off our DB, and before we administer our TB test, we are going to check for our third and final time. On our rights against our MAR, we're going to say that this is TB test or tuberculin. It is 0.1. It's supposed to be given intradermally to Jonah Doe. and 0.1 milliliters, and it is not expired. Checking everything against my MAR. I'm going to dispose of my bag. And now that I have wiped off my spot, I'm going to remove my cap. And before I give any things, I need to make sure that I ask them about their allergies. I've done this video multiple times. I couldn't remember if I did this video yet or not, but you always ask about your allergies before you give your medications. And you're going to go into a 15-degree, getting just under the skin. You're going to slowly inject and create a wheal. And here my weenie popped from the wheel. I've never had it do that before. You can see that I've made other wheels in my practice, but in this last wheel, I don't know why it is a cheap weenie, but the weenie just exploded. So after that, you are going to activate. You're going to dispose of it in your sharp disposals box. And you're going to put your alcohol swab, and wipe off the blood if there is any, and then put your Band-Aid on. And see, these are the only size Band-Aids that I have, and for that I'm not going to try to put my Band-Aid on. So, moving on from the intradermal, we're going to replace our gloves, making sure to do the correct way, that we don't touch any of the sold areas and dispose of them. We're going to do our hand hygiene again, and we are going to go ahead and check our 3 rights for the third and final time, or the third time check our rights on our MPH. And see here on my bag and on my MAR that I have MPH 10, MPH 10 sub Q at this time, sub Q at this time for Mr. Jonah Doe. That is not expired. I can also be checking that for my R, 5 units regular, 5 units regular, sub Q at this time for Mr. Jonah Doe. So I'm going to replace my gloves. And giving the sub-Q injection, you're going to have to go at a 90-degree angle on your sub-Q injection. We're going to need our alcohol swab. So we're going to take our alcohol swab, and we're going to wipe off the site of the injection around 2 inches around where we're going to be injecting. I'm going to leave that right there. I'm going to remove our cap, and in a swift dart-like fashion at a 90-degree angle, we are going to go in and give our injection. So a swift 90-degree. What I'm going to do is I'm going to slowly inject. It says about 1 milliliter per 10 seconds. I'm going to slowly inject my insulin. And I'm going to leave my syringe here for at least 10 seconds. I know that because that is supposed to keep there from being as much blood coming out, and you always want to leave your syringe there for 10 seconds. So I'm going to remove my syringe, place my cap. I'm going to activate and also dispose of it in my Sharps disposal box. I'm going to replace that, and we're going to give our Band-Aid. Now that moves on to our last. I'm going to replace my gloves again, making sure to take them off the right way. And then I'm going to hand hygiene again. I'm going to prepare to give my last injection. So my last injection I have here is Rocephin. Again, we had to do our dose cal on this, where we have on hand 500 milligrams per milliliter, and I can check and see that I do have 1 milliliter in there for this one. And I'm going to go ahead, while I'm putting on my gloves, I'm going to be checking my bag against my MAR for my third and final check on my Rocephin. So we have ordered Rocephin 500 milligrams, 500 milligrams for Jonah Doe. For Jonah Doe, I am 1 milliliter. It is not expired. And I'm going to take out. Now, one thing that we're going to have to do on this one, I have my extra needle here. You always want to have a different needle that you inject with and then what you draw up with. And I am going to replace my needle. Is being kind of hard there. Normally it isn't that difficult. And we are going to replace our needle for our injection. Now that we have our needle replaced, we are going to take our alcohol swab. We're going to wipe 2 inches around the area that we're about to inject. Leave our alcohol swab there so we can wipe away the blood. I'm going to remove my cap. See again that I do have 1 milliliter here, no air bubbles. And we are going to inject at 90 degrees in a swift dart-like fashion. So when we're in there, first, before we go, we are going to aspirate some to make sure that we do not see any blood. If we have any blood, we have to restart over because we might have hit a vein. And then we are going to slowly inject, again, a milliliter per 10 seconds. Then we're going to hold our syringe in there, make sure that we do have anchored our syringe and as we inject, and we are going to hold it there for 10 seconds. We're going to take the alcohol swab, put it over the blood, again put it in our sharps disposal box, and remove our gloves so it's going to be easier to get to my Band-Aid. I'm going to take my Band-Aid and replace it over the wound. And finally, I'm going to perform my hand hygiene. I'm going to ask them, is there anything else they need? Make sure they leave them in call light up, bed rails up ×2. And then the next thing that I would go out of the room and I would start my documentation. And now I'm going to go back and I'm going to show my placements for the shots. So the next thing I'm going to be doing is I'm going to be showing my placements for my injections. And the first one is going to be your ventrogluteal. And you're going to start by placing your palm on the greater trochanter, and you want to get them to move their top leg like that. So you can find that joint right there. And now that you've found the joint, you want to have your thumb pointed towards the groin area and your index finger pointed towards the axillary. And you want to try to move and make a triangle there, because that is where you are going to put you're going to want to put your pad there to mark it It'd be easier to have that with two hands. And in that triangle, just an inch below where you put that pad, is where you're going to be making your injection. And your next is your vastus lateralis, and you're going to start again with your hand on the greater trochanter, and you're also going to find the femoral conductile, which will be right above the knee. It's a protrusion right above the knee. And you're going to make a rectangle-like shape with both hands, like that, with the bottom thumb being the bottom of the rectangle and the index being the top. And on the middle thirds of your rectangle is where you're going to want to place your shot. So the next thing we're going to be doing is our brachial. We're doing for tuberculin test. You're going to want to find the antecubital area first, and then you're going to want to find the wrist area, and you want to get in between in the middle of your antecubital and your wrist. You want to make sure that you find a place with no scars, no hair, the clearest site possible. And then for your deltoid injection, what you're going to do is you're going to find the acromion process at the top of the shoulder. Find that bone, place your pinky on that bone, and have your forefingers right there. And then you're going to slide down your forefinger, and that triangle right there is going to be where you're going to place your injection right on top of that muscle. And in the case of a older patient, or if the muscle is not developed very well, you might pinch up that muscle to where you can see it. And that is it on my placement. So we've left our patient in a comfortable position with bed rails up ×2 and call light within reach, and instructed them if there's any pain or anything that they need, that we will be there and to hit their call light. So the last thing we're going to do is we're going to go document what just occurred. I'm going to start with reading my documentation. What I have here is the first one, sub-Q. We document April 22nd, 2020 at 0800. We did a finger stick / blood sugar that was at 162. Insulin MPH 10 units. Regular insulin 5 units administered sub-Q right upper quadrant of the abdomen. No bruising noted. Bed locked, bed rails up ×2, call light within reach. Reminded patient to call for assistance getting out of bed. Signed, I. Fowler, student nurse, SSN. Next, we have our intradermal. April 22nd, 2020 at 0900. We explain the purpose for the skin test. The patient verbalizes understanding for the reason of the test. 0.1 milliliter tuberculin purified protein. Lot number 12345, injected ID in right forearm, 1-inch circle around the bleb. No reaction noted 5 minutes after injection. Test will be read on April 24th. We instructed the patient not to scratch or apply lotion to the site or scrub or place a band-aid on the site. Signed, Isaac Fowler, SSN student nurse. April 22nd, 2020. 0910, this is for my IM. Rocephin 500 milligrams was administered IM in the left ventral gluteal site. No complaint of pain, numbness, or tingling. Signed, I. Fowler, SSN student nurse.